Great. Now that I've remembered to turn the record button on, we're all good. So that's great. So welcome everyone. My name is Daniel Stein. I'm one of the co-founders of Stewards of Change and the National Interoperability Collaborative. And it's Friday, so it must be Let's Get Technical again, which is a Friday call we've been holding now since September. So welcome folks to the call. And we're excited about today's conversation in particular. We have Daniel Hempel and also our own Adam Pertman here talking about child welfare and what's coming up and why information sharing matters. It's a critically important topic. Many of you, and we'll find out how many of you in particular, are involved with this topic. We know it's a complicated topic and lots of stuff going on around it. So, you know, we're sort of pivoting from a very deep dive kind of technical conversation we've been having for the last couple of weeks to a programmatic and a policy kind of conversation today. And one of the things we're hoping to do is really bring in multiple threads into that conversation, folks who are either directly or indirectly touching or involved with the child welfare, foster care, and adoption system. As you know, and I don't need to say it, there's a lot of interconnectivity, especially around the technical work that we're doing, and also in particular the proof of concept, which we'll reference a little bit later. So with that, I'm going to just get started here. And so a little bit of housekeeping work, just to mention. I think everybody's muted when they come on, but occasionally you'll unmute yourself, and just be aware of that. So when you're not, especially if there's background noise going on, if you could just make sure you mute yourself, because it's distracting to the presenter and the listeners there. So you can obviously view the video on your computer or on your phone as well. I think it works that way as well. And so we want to hear from you during the call today. And I know we have a number of questions and opportunities for engagement and discussion. So we're hoping you'll take advantage of that as we go through it. In the navigation bar, if you're new to Zoom, please find your navigation bar. It's either at the top or the bottom, generally, and you can find both the participant list and as well the chat list on there. And you can actually open the chat list and keep it open on your screen if you so wish to add questions or ideas or comments, and we'll be referring to that regularly. We want, as I said, to hear from you on the call. So put your comments into the chat box, raise your hand. There's an option to raise your hand, or just break into the conversation as the spirit moves you. As I've often said, you know, webinars are not the most natural place to have conversations. So sometimes we step on each other's words. That's fine, especially if we're motivated to engage in the conversation. You get extra points for that, actually, if you do it. So no problem there. And for those of you who are using your phone line only, you can just mute and unmute using *6. One other piece here is we are recording the session like we do every session and posting that on the hub. That should be up by just in a day or two. So you can pass that along or go back and listen to it. And of course, you can always binge watch the other sessions that we've held over the last number of months here. We hope that you've signed up for the NIC Hub, and the URL is there. There are lots of conversations, lots of materials, lots of things going on related to this call, but also many other topics, as I'm sure you're familiar with as we go forward. So our agenda today is pretty straightforward. We have our usual new participant introductions. We'll take a few minutes to ask people who are new to the call to say who they are, where you're from, what you do. It really adds a nice texture to the conversation. We do have a lot of people coming back multiple times, but new people come into the conversation. It's really great to hear from where they're from. And I'm sure based on this particular topic, there are a number of folks who are known to both the presenters and others on the call. And then Adam Pertman will give a little overview of the child welfare adoption space for those of you who are new to it or want a little bit of refreshment of some of the key ideas. And then Daniel will lead us through a conversation discussion around what's really happening now from a policy regulatory perspective and new trends. So it should be engaging and interesting and very relevant and prevalent, or very relevant to what we've been talking about and will be talking about. You'll notice there's a couple of upcoming events scheduled. We have several more coming up. On 3/6 will be data trusts from Bright Hive, fascinating way of looking and using information. And then there's a couple more that will be scheduled for the 13th and the 20th. We're just getting those finalized now. And then on the 3rd, we have a call with the public libraries and the opioid crisis, which is an amazing, fascinating project that they've been working on the last couple of years. We'll talk more about that, and you'll see the announcement in the newsletter. But the giant network and a way for us to think about disseminating both technical knowledge and community-based knowledge will be terrific. So with that, we want to go to some introductions. The way we do this is for people who are new or haven't been here in a while. If you type your name into the chat box, I will call on you. You have to unmute yourself. You may need to unmute yourself twice, both on the computer and on the phone. Or if you're just on the phone, *6. I'll call on you and just tell us your name, where you're from, kind of what you're involved with. Kind of keep it quick because we want to go through a lot of these. But so the first one up is Christine Gaines. Welcome. Or actually Mary at first, but go ahead.
Okay, we'll
Christine.
go with Mary. Go with Mary.
Okay, Mary, you're up first.
Oh, hi, everybody. I'm Mary McCarthy. I work at the University at Albany in Albany, New York, and I'm the co-principal investigator for the National Child Welfare Workforce Institute, which is funded by the Children's Bureau.
Fantastic. Welcome. And I might say Mary was also the first one on the call this morning, so you got extra points, Mary. Thank you. Christine.
Yes, this is Christine Gaines. I actually work with Dell Technologies, and I support our state and local government solutions and work directly with a number of companies that are building the child welfare modules or solutions in the marketplace. So leveraging our technology underneath to solve for our business problems.
Fantastic. That's great. Thank you. David.
Hi, my name's David Bucciafero. I'm with Foothold Technology. We're in the HR vendor. I also am the co-chair of the Electronic Health Record Association Opioid Crisis Task Force and Patient Safety Task Force, and a member of their executive committee. And so I'm somewhat indirectly involved in this topic, but more involved in many of your other topics. And for Mary, I'm located in Scotia, New York, which is right next door where she is.
Oh. Neighbors.
Sure.
Courtney.
Hi, can you hear me okay?
Yep.
Hi, my name is Courtney Powell. I work at the Mona County Office of Education. We are located in California. We're a rural area. You might know us because of Mammoth Lakes, California. I am a program coordinator. I coordinate for our foster youth services in the K-12 system. And then I also am the coordinator for our Child Abuse Prevention Council.
Welcome. Thank you. Great. So Marina. While Marina is looking for her unmute buttons, Mark, if you're there, Mark Needle.
Yes, I am. I do policy work with the school district in Miami-Dade, Florida, but I also facilitate a data collaborative across early learning providers, and am particularly interested in this area because we want to include child welfare in that 0 to 8 space. So thanks very much.
That's fantastic. Yeah, and we'll be doing some more work soon around early childhood and early learning. So stay tuned for that. That would be great. Marina, are you unmuted yet?
Am I unmuted?
There you go.
Yes, I think
Absolutely.
I am. There we go. Hi, Marina Pascali. I work with IBM in the Government Health and Human Services, and I'm actually responsible for our child welfare solution.
Oh, great. Welcome. We have had a number of long-term relationship with you guys, so welcome. Who's next? Let's see, Jamie Partridge. And while Jamie looks for the unmute button, is Chris Schuster up? Who's ever first?
Hi, this is Jamie. Can you hear me?
Yes. Hi.
Okay, great. I'm a senior study director at LESTAT, which is headquartered in Rockville, Maryland, although I'm outside of Atlanta, Georgia. And I do child welfare research, regularly provide TA to states and counties on data and data sharing.
Great. Fantastic. Great. And Chris, are you up?
Yes. Can you hear me okay?
Yep.
Fantastic. This is Chris Schuster. I work with KPMG. I'm based in Pennsylvania. We provide services to the Commonwealth of Pennsylvania, a variety of those, one of which is the strategy and planning in their child welfare space. And so just glad to be on the call and part of the conversation.
That's terrific. That's wonderful. Great. Jeremiah.
Yeah, can you guys hear me okay?
Yep.
Perfect. My name is Jeremiah. I'm a former foster youth, have done a lot of work with CYC, California Mental Health Advocates for Children and Youth, now a commercial real estate agent here in San Diego.
That's great. Thanks. Welcome. Kimberly, I see you put a little bit of note up here. If you want to say hello as well, that's great. Okay, maybe you may not have audio there. Okay, let's move to Nabil. Going once, going twice. Okay. Nabil, if you do come on, if you can find the audio, that's great. Otherwise, I think Kimberly says she doesn't have audio here as well.
Yeah.
Okay, well, welcome everybody. Anyone else want to say hello that hasn't put their name in? Feel free, now would be a good time. And if not, then we will move forward. Okay, thank you for everybody who's joined. I'm always delighted by the breadth and the diversity of folks who are joining these calls. And for those, again, just to pitch, if you haven't joined the NIC, go ahead and do that. If you, as a member, add yourself in there, we can find you and others can find you. So that should be a real benefit to the people who are participating. I just want to spend just a very short moment of time here talking about the NIC. This is a slide we use every time because there are new people. So NIC is it's a community of networks, and it's designed specifically to work across domains and sectors with a focus on improving, health, safety, well-being operations as well. And under a grant from the Kresge Foundation, we've been able to focus on building this for the last couple of years. And over the last year or so, the NIC itself, the hub itself, has been up and operational. And so we're excited about the momentum and the excitement and the participation of the site itself. We've got close to 1,000 members and different levels of interest, and continues to be growing all the time, which is great. The key focus here is recognizing that there are multiple domains. We've identified 6 here in particular: human services, public health, education, public safety, emergency medical response, healthcare, IT, recognizing that many things fit underneath that, so behavioral health, mental health, transportation, work, but we needed to sort of create a sort of a meta structure and then look for the commonalities and differences across these different domains, because there's a lot of duplication of effort and not a whole lot of coordination of information sharing. So there's a lot of duplication and repeating of things that we might be able to learn from one another. And that, in many ways, is really the core idea of the NIC, is to see if we can begin to facilitate more of those cross-domain conversations, kind of like what we're doing here today. If you're interested in more details around that, we did do a publication for HIMSS, which looks like this. It's on the sites, and it really kind of goes through each of these different domains, looking at sort of policy, strategy, technology, operations, sort of key opportunities for sharing information. It's a good foundation for thinking about multidisciplinary, cross-sector kinds of work. And that's kind of what drives our interest every day. And the more we can do that, the happier we are. And hopefully we're adding some value to the conversation out there, especially as the world works and moves more towards value-based payment and integration, whole person care, those kinds of things. So with that, I will turn my attention to the beginning of our session here. And before I introduce Adam Pertman, who will take us through some basics, I want to engage everybody in we have a couple of polls here just to gauge participation and involvement in it. So there's 3 questions here. I'm going to launch the poll. Hopefully everybody sees it. And the way this works is you can vote on each of them, and we'll leave the door open for just a minute or 2 for you to read through the questions and give us your thoughts. And then we'll show the poll here. So get ready, set, go. We should have some background music, I think, you know, for the Price is Right or one of those things. Do, 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 do. Keep it interesting for folks. I'm sure Zoom has that functionality somewhere built into it, right? Background music and pictures.
So there are some people who do not see what's on screen, correct? If you're just on your phone. So I think Daniel Hempel and I both need to be mindful of that. I was reviewing my slide this morning and realized I probably do have to read some of it out loud. I don't generally like reading from my own slides, but we need to be mindful that some people do not see slides.
That's true. We'll just give it another couple of seconds. We've got 40 participants here, 40 responses, and going once, going twice. Okay, I'm going to end the poll and show the results here. And this is probably a good way of sort of segueing into Adam's presentation here. Do you see the results, Adam?
I do not see results. I just see
share results. Okay, I'm going to share the results. There you go.
Yes, we see them now.
Now you see them. Okay, perfect. Okay, so so what's your familiarity with child welfare, foster care, and adoption? 43% said frequent. 38% said occasional, and a few people, about 20% said rare or none. So pretty highly engaged group of folks.
Yeah.
What's your level or frequency of interaction with child welfare? Seems to be sort of similar results, pretty actively engaged. And what's your primary focus domain? Most people are in the social services, human sector, 18% education, 1 person from public health, nobody from public safety, and 9 people or about 23% from healthcare itself. So a pretty broad range, mostly social, education, and healthcare IT, which makes sense. Adam, any commentaries? We can move right to...
only that we have a good self-selected population. I would bet that most of on our technical calls, those numbers would be different.
Yes.
But I'm delighted that that these people showed up. I think we have Daniel Hempel to thank a bit for that.
Great. So, so as I said, we're going to transition now over to Adam. Adam is a senior consultant to Stewards of Change for a bunch of years. And does a lot of work in coordination, communications on the NIC, and lots of other work, and brings his expert journalistic skills to a lot of the writing that you may see on our work here. And before that, he's had multiple other careers, including most recently the Donaldson Adoption Institute, where he was leading that, and then also as a journalist before that. And his book on Adoption Nation was reviewed as the most important book ever written on the subject. So with that, Adam, let me turn over the microphone to you.
Thanks.
I'll drive the slides.
Great, thank you, Dan.
Take it away.
Yeah, I paid a lot of money for that review, so better use it. Okay, yeah, let's go on. So I want to make a couple of general comments first. Everybody who's been on these calls and everybody who works in the interoperability space knows for real that one of the biggest challenges that we face is confidentiality and privacy issues. When it comes to child welfare relating to those, you ain't seen nothing yet. This is an institution that's built on confidentiality and privacy. So some of the challenges are just so significant, and the extent to which the issues in child welfare intersect with other domains, with the whole gamut of social determinants of health and well-being, it's huge and needs to be necessarily to be huger. But those issues have gotten in the way throughout the history of child welfare in this country, and it's very challenging. I think the better we all understand the needs, the more we will understand that we need to be involved in them. And the limits on how much there is involvement currently cross-sector are largely due to a lack of understanding of child welfare and child welfare's own limitations on what is permissible and what's not permissible. So just for context, I want to say that. So I'm going to very briefly introduce the National Center on Adoption and Permanency, otherwise known as NCAP. We have a team of people, around 30 people. We do technical support, technical assistance, education, everything from on the ground to policy change. And that's really where, at the bottom line, we are aimed. The paradigm in child welfare has always been, and in adoption, encompassed by child welfare, has always been all about child placement. The mantra is every child deserves to have a safe, permanent, loving family, and I think we can all agree to that. But as you'll see in this presentation, one of the fundamental problems with that paradigm is that because of the nature of the children, and somewhat because of the nature of the adults in the picture today, those aren't enough, because we form tens of thousands of safe, permanent, and loving families every year for children, and their life is so difficult every single day. So the question is, are we doing our jobs for them? And I formed NCAP because I think the answer is no. The paradigm needs to shift to helping these families and these children be successful, however that's defined, and we're not going to go into all of that today. But that's the nature of NCAP, is to move the goalposts, if you will, down so that success is the real goal. So what I want to do with this presentation, which is basically a 10-minute synthesis of a half-day training that I do for professionals around the country. But anyway, we'll do it in very short order. I want to contextualize what Daniel is going to present after me. What do we know? What don't we know? What are the real needs of this population? And what is the nature of the population? Because I will tell you that the lack of information about that is huge, again, largely due to the history of secrecy, privacy, and all of that. So we're going to do another poll. This is just for fun. Everybody answer to the best of your ability. You don't have to be right, and your name isn't attached. And you'll see why I'm doing it once it is done. So how many children are adopted in or into the U.S. each year, meaning from other countries, from foster care, infant placements, all of the above totaled, and including step-parent all adoptions. And this is, you'll see why I go to adoption as the metric here. If everybody could just fill that out. I know the answer, so I'm not going to do it. So can we, Sandis, can we go right to the second question? Let's ask all three questions, and then I'll get back to all three.
That would be Daniel. Daniel?
Oh, Daniel,
Yeah.
can you go to the second question?
I think people are just finishing up now.
Oh, okay, great.
See if I can.
There are three questions, and I'm going to, let's run through all of them, and then I'll go back and answer them. Oh, that's the same thing. Okay. So for those on the phone, so the first one asks how many people are affected, how many adoptions are there? Adoptions were 85,000, 125,000, and 175,000. None of them, by the way, small numbers, right? So this next question is, of the three categories of adoption, which one occurs most? International, from other countries, from foster care, or of infants adopted domestically, babies, baby adoption, which are voluntary placements by the women involved. Which one is most prevalent? Let me just say while you guys are doing this, that please take to heart what Daniel said at the beginning. I 100% don't mind being interrupted. I'm going to go through these slides pretty quickly, and if there's anything on any of them that you want clarification on or want to comment on, please jump in, because I'm just going to go through them.
Okay, I'm going to close this poll. I think we're at
Great.
Almost 60% participation. Ready, set.
And
okay.
Last but not least,
last one here is. There you go.
There we go. How many people in our country have adoption in their immediate families? And let me define immediate family as everything up to, but not including, first cousin. So uncles, aunts, grandparents, grandchildren. Adopted people grow up, so they become grandchildren. They have nephews and nieces. When they're kids, they have uncles and aunts. Or when they, so that's how we define immediate family. And obviously, none of these numbers is small. And the point of that is that we need to be more involved cross-sector because it is just a whole lot of lives, even the smallest number. And the options for those on the phone are 45 million, 85 million, or 100 million people in this country with adoption in their immediate families. Let me know when you close it and we can move on. So when I give this as a training, I sort of go back and forth with research, with experience, with what we know and how you derive it. And there's a lot, this is a very heavily researched presentation, though you won't see the pieces of research today. But in this case, I'm just going to give you the answers as I see them on the screen. So how many children are adopted?
The results? Yep.
Okay, so I'm just going to give the answers. So how many children are adopted in or into the U.S. each year? I always get 175,000 as the biggest answer because people figure, oh, that must be it. That's why he's asking the question. It's about 125,000. It's in the middle, and that includes all the kids adopted. Again, including step-parent adoptions. The number has stayed pretty flat over time, but the nature of the children being adopted has radically changed. We'll get to that. But it's a pretty big number. Okay, next. And just think about that over the course of time, 125,000 a year, and you get into some serious millions over time, right? Okay, of the three categories of adoption, which one occurs most? And so this is an informed audience. I rarely get the right answer as the majority answer. So yeah, it's 55% from foster care. That is correct. International adoption is widely perceived as either first or second. It's in fact third. The number of international adoptions has plummeted from roughly the highest ever was about 23,000 into the U.S. from other countries. Today, it's about roughly 4 or 5. It has plummeted, and that's a whole other story. And infant adoptions have stayed pretty flat over time, about 14,000 a year. How many people in our country have adoption in their immediate families? Again, none of these numbers is small. The winner here was 85 million, followed by the correct answer, which was about 100 million people, so roughly a third of the country. What I want to say, the most important thing I can say in regard to this number, and it's a pretty darn big number, and I think most people don't have a clue that it's that big, is that this is just a fraction of the people touched by the subject that we're discussing today. Because these are the ones that have adoption. Most children, there are almost 500,000, almost 500,000 kids in foster care at any one time. The overwhelming majority go back to their families of origin, so they need all kinds of services across sectors. But they're not captured in this number, right? And families of origin, the birth families, are not captured in this number. So we are talking about a huge population that is affected by child welfare issues writ large, huge. Okay, let's keep going. So an extremely brief history of adoption and child welfare in the U.S. is what this slide says for phone listeners. So I'm not going to read all of these to you. I will synthesize adoption in this country: formal legal adoption. Adoption in communities of color has always been a thing, but grandma took care of the child, the aunt took care of the child. Formal legal adoption in this country, excuse me, in the last century was created with laws, policies, and practices that were based on white babies born to white unwed mothers, placed into families headed by white, heterosexual, married people. That's how adoption in this country started, and most of what we have for policy and practice is derived from those or rejiggered from those. Secrecy, stigma, and shame characterized everybody, and most adoptions were closed. People did not know each other, not from foster. The permanency plan for children in foster care was foster care. Children were not adopted from foster care. That was not considered, they were considered, excuse me, quote, unadoptable. Once we learned roughly in the 60s during the Civil Rights Revolution, the Women's Rights Revolution, all those revolutions, single motherhood started to become increasingly accepted, and it turned out most mothers wanted to parent their own kids. And so the supply, if you will, of infants, white infants, available for adoption plummeted. And at the same time, abortion was legalized, or there was the pill and other forms of birth control, and the availability of those infants plummeted, and it changed adoption in this country forever. I say in this slide, the world events filled the gap. The Soviet Union broke up, and nobody said, oh my God, an adoption event. But we saw that there were orphanages teeming with children, and Americans went to adopt them. Those infants were not available. These children were. China imposed a one-child policy. The world did not say, oh my God, an adoption event. But it sure was, and it changed the face, literal face of adoption in this country and many others, I have to say. And in roughly the same time period, under the Clinton administration, foster care, can you go back to a sec? Yeah, the paradigm in foster care went basically from, this is real basics, from family reunification almost no matter what, to best interests of the child as defined by permanency. And so what you see there is the shift of children, white infants, and then over time to children from other countries, so it's multiracial, multinational, multi-ethnic, and then when you add the kids from foster care where they're disproportionately, not majority, but disproportionately minority kids, then you start to see these fundamental changes in adoption and the needs of the people. So what has changed? I'm not going to go into all of this, but anybody old enough knows that picture in the upper left was from a show called Father Knows Best. And if you watched television America in the 50s, you knew that everybody in this country was white because that's all you saw. And this has obviously changed a lot, and you know the modern family is one exemplar of that. And it's not all about adoption by any means, as shown by the Obama family. So where are we today? Excuse me. So fewer than 1% of single women voluntarily place their kids. So infant adoption is not the biggest number. It's very small. It's not the smallest because international adoption has plummeted. There's still lots of stigma, secrets, embarrassment, shame. But greater honesty and openness are the distinct trend of the field in child welfare, broadly speaking. Laws, policies, and practices have not caught up to these realities. And the biggest, one of the bigger lessons I would leave everybody with is we still don't understand adoption really well because of all of the stigma and shame and all of the secrecy that's involved. And so we don't understand people and their realities as well as we should. And that's part of the lesson plan here. But it's also a reason why there isn't more cross-sector work that's involved. So fundamental change, that bottom bullet is critical to understanding the population today. So we go from The jump is from those white babies, white mothers, white adopted parents, to today when the people adopting are straight and gay, they come in all colors, they're married, they're cohabitating, they're single, they're young, they're old, and the majority of children being adopted are not white infants. Go on. Let's go. Next slide. Daniel? Hello? Hello? Can anybody hear me?
Looks like we may have lost Daniel because the slides are gone.
Yeah.
Oh.
I'm back in.
Oh, there he is.
Yes.
Oops. I don't see anything on the screen. Is there something on the screen?
He's working on it.
Okay. Sorry, everybody. So I'll just interject something while we're waiting, which is that some of the public health issues and many of the individual issues, but some of the public health issues that we focus on, we don't realize the intersection with child welfare. So the best example today is probably the opioid crisis. In some states, not all states, because there are lots of reasons for things happening, but in some states, the population of kids in foster care has been rising the last several years, partly because of the opioid crisis, because of what's happening with their parents, and they wind up in foster care, either temporarily or longer term. So these are really, the issues we deal with really intersect with this population in significant ways. And that's just one example. And I'll give you more if we get more slides.
Daniel, I think he's back. Daniel, do you hear us?
Sorry, everybody. We'll get it straightened out. I think.
Yes, he's sharing. Daniel is
Great.
sharing slides.
All right, terrific. All right. So sorry about that. If we could just go into sharing mode, and I just have one more slide. So, no, wait. Can you back up one? There, that I needed. Yeah, go to this one. Yeah. Okay, if you could show that pie chart, please. So I don't know if I'm going out of order, but I just want to illustrate what we're talking about here. This is a few years old, and whoops. Okay, I'm not sure what to do here. Daniel, we've lost you again. Sandis
I'm gonna share my screen.
That's what I was going to ask you to do. Okay, thank you.
Okay, 1 second. But he needs to stop sharing. Okay. Okay. So I'm gonna share my screen.
Thank you, Sandis.
No worries.
What were we saying about the technology is not there yet?
Do you see my screen?
No, it just says you started sharing. Yes, I do. Okay, so okay, to the next slide, please. So where are we today? I went through this, so the bottom line being that most kids are, okay, that's fine. So this is roughly where we are. The numbers have changed a little bit because inter-country adoption, international adoption has dropped some in the last few years, continued to drop. But this is roughly the right numbers. And what you want to, we'll go back to it in a second. If you go to the next slide. So what you saw there was the overwhelming majority of adoptions is indeed from foster care, and that's the important thing to keep in mind. So some bottom lines, there, we have greater openness, but people still, we're not there yet. Adoption and fostering have contributed to historic changes, and this is a subject for a whole nother presentation, in perceptions and understanding of what families are, how they're formed, what they look like, to a far greater extent than even the numbers themselves. The vast majority of adoptions are now of children, and this is the aha moment for everybody. The vast majority of adoptions are now of children from foster or institutional care. In other words, in this country or from institutions abroad. In other words, they suffered early life abuse, neglect, or institutionalization. And the bottom line is that most laws, policies, and practices in place today are not made for that population. They were created for a world that no longer exists. Back up one, and I'm to the pie chart, and I'll make the point, and then I'll wrap it up. The pie chart. So if you do the math, I'll do it real quick. If you add up the inter-country adoptions with the foster care adoptions, what you learn is that at least 80%, it's higher, because not all the infant adoptions are of healthy white babies or of healthy any babies, any color. But at least 80% of all adoptions in America today are of children who were abused, neglected, or institutionalized. They all have special needs at some level. And that's the cross-sector stuff. And go to the last slide. And that's where we are failing these families, where success needs to become, in NCAT's view, in my view, where, next one. This is where we are not doing the job, because we're not crossing these domains. We're not learning from each other. We haven't set up the technology or anything, or policy or anything else to get the information that's exchanged so that they can get everything they need. I'm not going to read this whole list, but all of these domains, virtually all of the areas in which everybody on this call work, intersect with child welfare, or should. From health and healthcare to transportation to public safety to the courts. Just use your imagination, especially for kids in foster care. All of those are relevant. When a kid moves from one family to another in foster care, they usually move schools. Where's their support system? And finally, the economic and racial disparities are enormous, both as a root cause for what is happening and for an easy example, because this is true in lots of circumstances, what happens when a parent of one color is raising a child of another color? There needs to be support, there needs to be education. It's a whole range of cross-domain work that needs to be done that isn't done today, and that leads, I hope, to Daniel Hempel's presentation, where we see some of the progress that is being made in legislation that's in the hopper or that has been implemented in recent years. And that's it for me. Thank you all. Happy to take questions later or now if anybody has one, and then turn it over to Daniel. Hello?
Hello?
There
you are. Can you hear me?
Yeah.
Yes.
Great. Thank you, Adam, for setting the stage here. I mean, I'm kind of, I'm a journalist turned child welfare expert, which Adam is sort of the OG on. He wrote the book on adoption, and as we were discussing before everybody jumped on, he had been nominated for a Pulitzer Prize for his work at the Boston Globe, also on adoption. So he's, sort of what I would love to be. So I'm glad we got to hear from you, Adam. Thank you very much.
You're very nice.
I'm Daniel Heibel. I'm the president and founder of Fostering Media Connections. We're a national nonprofit news organization that covers child welfare, juvenile justice, and really any issues affecting vulnerable children, youth, and families, all the way from birth through outcomes for young people who have experienced these systems. We have 3 programs. We have the Chronicle of Social Change, which is an online news site that covers these issues daily. We also have Fostering Families Today, which is a print publication distributed to foster families across the country. And thirdly, I'm very excited about our Youth Voice program, where we train young people who have experienced either foster care or the juvenile justice system how to produce journalism, pay them for that work, and that work appears across our platform. So that's who we are, and we also work very closely with other media outlets to ensure that our stories have broader reach. I see that there's people Adam referenced, and I see that there's people on this Zoom call who are working on the opioid crisis as it pertains to families. I was just in Ohio working for a network that I will not name here, but we'll have a forthcoming show on a major network about really some amazing interventions to keep families together despite this raging crisis. So next slide, Sandis, please. Or Daniel Stein. So I want to talk briefly, and I really want people to jump in whenever, and I don't know the exact protocol for doing that, but please do jump in if you have any questions. I'm just going to talk a little bit. There's about three major issues that we're going to be covering in the pages of the Chronicle of Social Change in 2020. So I wanted to go through that. Can we have the next slide, please? So the Chronicle, as I mentioned, we're this national news site covering child welfare, juvenile justice, and these types of issues. We have staff in Los Angeles, the San Francisco Bay Area, New York, Florida, Arizona, Michigan, as well as Wyoming. So we kind of have a national spread. We pride ourselves on covering federal child welfare policy very well, and then trying to tie that to what's happening on the state and local level. Next slide, please. So let's talk a little bit about these stories. So next slide. The rise of relatives. So this is, I think, a really important issue for anybody who cares about child welfare, is that you've seen over the last, since the start of the 2010s, you've seen the child welfare system, during a period of, as Adam referenced, the opioid crisis has led to increased numbers. Those numbers, overall numbers of kids in care, has started to abate. But during that period, you've had an increasing reliance on relatives. And, the literature suggests that relatives are the better placement for kids entering the foster care system. There is, of course, countervailing evidence on that as well. I mean, it's not a clear picture, but what is clear is that while 40 states saw an increase in foster youth living with relatives, can we go to the next slide, please, Sandis? Well, we saw this increase. We also know that relatives are systemically underpaid and undervalued in this system. So without relatives, the child welfare system, as numbers have increased, in part due to the opioid crisis, in part due to the swings in policy that happen when you have systems that try to be less aggressive in child removals, but then result in having more, when that goes wrong, when there's a child death or two, then they become more draconian and start removing more children. So as this has happened, you've seen relatives increasingly relied upon and invariably underpaid, undersupported. And I think this is a huge issue for the system, and one everybody should be watching. We found this out because we do this annual reporting project called Who Cares, where we account for the number of children, the types of placements that children are in, whether they're in a foster home, whether in their relative placement, or they're in a group home. And importantly, what we do that the federal government doesn't do is we measure the capacity of those systems to take in those kids. And we do information requests to every child welfare system in America. I see there's somebody here from Maine. Thank you, Maine, for responding to our requests. And then we deal with AFCAR's data, which is federally collected data, to shed light on these two critical issues: how many kids are in foster care today and where are they living. Next slide, please. So, when it comes to relatives, you saw, 30 of the states have an uptick of 40% more relatives. And this is an issue that will become only more pressing. We're going to talk about this in the next area to cover, which is the Family First Prevention Services Act, which wants to prevent entries into foster care and will rely very heavily on relatives to do so, and interestingly doesn't include any new monies to pay for relatives to take care of those kids. So the number of youth living in a home without a placement went up 32%. Let's skip to the next slide, sorry. It's not as important. And then I want to talk a little bit unpaid placement. So you saw from 2011 to 2017, as the system has become more reliant on relatives, they're also often not paying those relatives. There was even a case in Kentucky where it was pointed out, and the outlying states are now required to pay relatives as much as non-relative foster parents. Next slide, please. So let's talk about family first. I wonder if we could do a little something Socratic, and if anybody would be willing to jump in and explain what the Family First Prevention Service Act is. Is there anybody who can help me with that? I see there's some real child welfare geeks out there, or experts, I should say. I think over the years I've become quite geeky, so. Nobody wants to help me? Okay. The Family First Prevention Services Act is a federal law that started to go into effect in October of 2019, which essentially does a number of things. First, it for the first time offers federal funds to keep families together in the form of Title 40 of the Social Security Act, which pays for child welfare. States can be reimbursed for offering services to parents who would otherwise lose their children to foster care. So you're talking about families in crisis, and you can offer them largely substance abuse services or parenting skill services. And on the back end, it cuts federal payments to group homes, congregate care facilities down to 2 weeks in an effort to push kids out of those types of placements. All of this, of course, speaks to the need of having a system that is adequately capable of taking care of the kids that come into, that need it. Next slide, please. So we're looking at all the states that are starting to implement. There's 4, not 3, but 4 systems that have now plans with the federal government to implement this law, which is a big deal. By October 2021, all states will have to be doing this. So you can see that Washington, D.C., Utah, Arkansas, and Maryland have approved plans, and then you've got the rest of these that are who have submitted and are working to get approved. Next slide, please. And an important part of this is the types of programs that are being that are eligible for reimbursement from the federal government for those front-end services. So for a family that would otherwise lose their kid to the system, there are you can see the different brackets of types of interventions that are now approved of within within Family First's clearinghouse. So for those early adopter states, presumably they're going to be using some of these interventions: parents as teachers, nurse-family partnership, methadone maintenance therapy, which is a big deal, obviously, in the opioid space, to try to keep families together. And in this most recent trip to Ohio, I spent time with a young mother who had lost her first 2 children to foster care because she was heroin addicted. Then when I met her first, her child was 3 months old and had been staying at a specialized nursery in Dayton, Ohio, where the system allows the parent to keep custody. So during that whole time, even though the baby was born with neonatal abstinence syndrome and the mother had tested positive as well as the baby, the system allowed her to keep that child. And then, the next time I saw her, it was her last night before going into rehab, and she was on a major bender, shooting heroin.
Hey,
yeah.
Hey,
yeah.
question for this, Daniel Stein here. Two questions. One is just in terms of these well-supported programs, because I know that this is some new terminology in terms of the Budget Act of 2020 that I began to see. Are you saying that there's incremental funding outside of like home visiting programs out of MCV and HRSA that are now supporting these in-home intervention programs?
Far from incremental. Far from incremental. What we're talking about here is Title 4E of the Social Security Act, which is one of the last great remaining entitlements. So any child that's eligible, presumably, so the eligibility would be determined by the state, by whatever the standard is, which is not very clear for a family that would otherwise lose a child that's in an imminent risk of entering foster care, which is very, permissive. I mean, the federal government has been pretty permissive on what that means. They haven't really defined it that clearly. So, we're going to see what states are doing to try to widen the net for families that could get access to those services. But once that happens, they can get 12 months of services under Family First that will be reimbursable by Title 4E. So that's a 50% match. What's interesting is the way that the regs have been promulgated is that also, you could re-up after those 12 months are done. So this mother I'm talking about who, to conclude that story, I mean, just yesterday she was reunified with her daughter in that rehab. This all happened over the last couple of weeks of, within 10 days of being, shooting heroin into her neck, now is reunifying with that child, at least now with an open case. But, she would be eligible for these services, and the federal government could draw down, the state could draw down federal 4E funds to pay for them, which is a big step forward. And again, it could be 12 months and you can re-up. So this is, this is a huge opportunity if done right and if states are willing to put up the money. Of course, there's a question of those states that have Medicaid expansions, there are funding streams that will cover some of these interventions and more of them as they start coming into play. Does that help, Daniel?
Yeah, it does, because I know we just worked on some MCV programs, and I was sort of surprised by the magnitude of the program I was not really familiar with, and the Fed I think it's about $500 million in home visiting program assistance to states, which is a pretty small part of the overall need out there. So that's why I was asking if it's incremental to the MCV allocations. I know those are not sufficient to cover all of the demands and the needs and the providers. So I think what I hear you saying is that, yeah, there are some availability to draw down 4E, which is terrific in terms of providing more in-home early on services.
It's terrific, but I mean, the question is Nurse Family Partnership is the only program that's shown reduction in child maltreatment subsequently. So all of this, the funny thing about Family First Prevention Services Act is that the cabal of staffers who put this law together love to talk about evidence-based programs, but the only program in that list that you see on your screen that has evidence of reducing child maltreatment is Nurse Family Partnership. None of the others do. So, I think while the law suggests this evidence base, the reality of it is that, we've got a lot to learn in terms of how we're going to, what programs are actually going to work. And, there was a bill passed recently which offers new funds, including money to pay for research, of some of these other programs. So hopefully, the clearinghouse of reimbursable programs will grow, and hopefully we build a knowledge base for preventing child maltreatment, which we don't really have that great of evidence for. So I think for the home visiting world, smart administrators will, I think, be in a position to, to draw down these funds and really expand home visiting. Look, in California, the MICVI allocation for the state pales in comparison to what First Five Los Angeles, which is a part public, part kind of a publicly funded charity from smoking tax. They completely blow out of the water what the state is spending on home visiting in LA County. So there's a long way to go.
Yeah, so just a couple of follow-up questions, and I encourage other people to jump into this. Two things that come to mind. One is with the opioid settlement on the looming horizon. I wonder if there'll be a similar kind of First Five allocation of funds to support particularly children and families who are caught up as a result of addiction. I don't know anything. I don't know about that. I don't know if those are part of the negotiations, that some of those funds would be allocated in the same way. Maybe you know, or maybe other folks on the phone know who are following that legislation as to whether or not there's more money that could be allocated for this kind of work as well.
I don't know. I mean, I don't know what's going to happen out of those settlements. I know that, like, for example, in Ohio, the governor there, Mike DeWine, had a $220 million two-year allocation, which will go in part towards supporting family drug treatment courts, which I think are kind of critical in this vein. Interestingly, there was a carve out that what's his name? He tried to run for president from Ohio, the senator. Sherrod Brown with the gravelly voice.
Sherrod Brown, right.
Yes. Yeah. So Sherrod Brown in Medicaid has a new carve out for I think they're crisis nurseries. They're not crisis nurseries. There's a designation for them, and these are exactly what this situation I was talking about was created for. There is a nursery to take children with neonatal abstinence syndrome up to 90 days, and that one program in Ohio, Bridget's Path, which was based off one in West Virginia, Lily's Place, and now I think there's one in Arizona. So there's only 3 in the country, but there's a Medicaid carve-out for that. So then you could imagine, that expanding as well federally. I don't know what's going to happen with these lawsuits, but my hope is that the settlements would include monies that are taking into consideration both the nuclear family that is affected, mom, child, dad, but then also the relatives who are invariably being laden with grandma, grandpa, laden with the burden of taking care of a child, with many cases, as Adam referenced, the trauma of having been involved in the system, as well as the effects of neonatal abstinence syndrome and long-term effects, which we don't, which we will know a lot more about decades from now. But so I think there's a lot of interesting things happening in multiple domains.
Right. Yeah, one of the other questions that's come to mind is thinking about some of the audience here, because these have been oftentimes very technically oriented towards systems and interoperability, and in fact, the proof of concept we're developing with members of the NIC, looking at the connection between health, social human services, child welfare, and the courts. And one of the key things is the inability to share that information very effectively. And I know that's a major topic here. So I'm wondering, as you look at legislation, how much are you seeing, in addition to the new CWIS regulations, focus on actually getting access to the information, especially some of the programs which are not particularly plugged into information sharing at all, as we've seen?
Well, I mean, we have somebody here from Foster Youth Services up in Modoc County. By the way, I was just in Mammoth Lakes last week skiing, so I know Modoc well. But, you know, one of our representatives here in 2014 passed the Uninterrupted Scholars Act, which allowed social workers access to hitherto precluded FERPA information about the kids in their care. So up until that law was passed, you know, I'm a social worker taking care of a kid in the system. I can't get their student records, which is absolute nonsense given the fact that social workers are the most common thread because of all the displacement that foster youth experience while in the system. So that was changed. You know, I think that there's the lag in terms of, you know, you've got in child welfare administrations, you've got counsel that is very focused on not sharing information and worried about things they don't need to be worried about. I mean, FERPA being one, you know, that's over. So, you know, you need to, you know, I think there's probably more legislative fixes to be done. I mean, in 2008, the Fostering Connections to Success and Increasing Adoptions Act created a mandate that you have medical records that follow foster youth. You know, I don't know that that's happening with any regularity anywhere, but you have laws on the books saying it should be. And, you know, what we do a lot of is we use journalism as a hammer on compliance. So, you know, for everybody on the call, if you see a place where, you know, there's something on the books that would allow for information sharing that's not happening, we're happy to hammer. And, you know, that tends to get people to act.
I would open it up to people who are involved in that information sharing component. Is any questions that are coming up? You know, Dan.
Daniel, we are not hearing you very well.
Daniel, you're breaking up.
Okay.
Yeah, I'm gonna try the computer phone.
No, Daniel Hempel, you're fine. Daniel Stein, not so much. Daniel, can you type in your question or your comment?
And Sawdust, in the meantime, can we just go to the next slide and I'll get through this, and it ties to what Daniel was talking about. Okay, just, you know, we just mentioned the courts as sort of being a hub where all of this information comes through. You know, at Family First, the Family First Prevention Services Act was the biggest change to child welfare policy in a generation. You know, it tinkered with and it expanded an entitlement, you know, during a time of with strong conservative grasp on power, which is kind of interesting. But another major thing that happened in December of 2018 was that the Children's Bureau changed, opened up 4E even more. And what they did was now allow for states to reimburse for representation for both biological parents as well as children in foster care. So remember, you know, the dependency court system is civil, even though it holds, I would argue, look, I've got 2 children. If somebody removed my children and then terminated my parental rights, I would much rather face the loss of my liberty and going to jail. They call termination of parental rights the civil death penalty. So, you know, now that you're having federal funds, again, an entitlement opened up to pay for representation and what they call interdisciplinary legal representation, where you have social workers and all the rest involved, I think opens up a lot of opportunities for these courts where you've got, I mean, look in California, for example, the governor allocated $53 million more over the 150, so you know, a 25% new money allocation, of which they banked to get about $30 million back from the feds, you know, which is going to reduce caseloads for those dependency attorneys. And you know, with that, hopefully, you've got more opportunity for better legal practice, and better legal practice includes bringing in education, bringing in mental health, bringing in healthcare, and all of those different things. So I think for people who are interested in interoperability, there's a new era dawning in juvenile dependency courts. So that's the background on the family justice movement. And, you know, incredibly, you've had these two things that open up 4E, you know, which I think is very heartening.
So I want to jump in, Daniel's plural, and ask the question that Daniel Stein couldn't because of his phone. And it's a very, very good one. We have a bunch of people on the call who are involved in some way or another in child welfare and child welfare services. How much, I think it's a great question about how much is information sharing a hurdle to the work you are doing and want to be doing or think you should be doing. I would love to hear from some of the people on this call on that question. If you could just speak up.
And I'm looking for this, you know, I'm looking for the article we cite in the slide that there was a major study. It was out of New York, and I'm just trying to find that study for you, Stephanie. I don't know what your last name is, but I'm trying to find you the story we wrote about it so you can see what we're talking about. New York representation.
Can people hear me?
Yes.
Hello?
Yes,
okay,
we can.
Great.
Yes.
Great. I'm trying to figure out why nobody's answering the question. We could put up another poll to see how many of you feel affected. Do any of you have a literal, not sort of inherent to the process, but active experience in trying to get information to or from child welfare that involves your own work?
Stephanie, if you send me your email, I will send you the study. And Adam, your question again?
Oh, whether the extent to which anybody on this call, some of whom are involved in child welfare work, to what extent is information sharing or lack of information sharing across sectors, interoperability, either helping your work or stymieing your work? Let's see, somebody.
This is Christine McCoy with the VNA in New Jersey. I'm with one of the Integrated Care for Kids projects. And, you know, what I hear from my colleagues doing this, you know, work on the ground, you know, we are constantly sort of getting outreach from a set of nurses that work for the Child Protective, you know, Services Agency here in New Jersey. And, you know, at this point, we're not even talking about interoperability. That's sort of the next step. And in fact, the statement that's come out of our Department for Children and Families is that our DCF system has literally zero capacity for interoperability. It can't even output, you know, CSV files. And so they have to completely replace the system to even enter into that. But I think, you know, right now it's really more stuck at this sort of legal or, you know, people's concerns about legal sharing of information. And we're seeing the biggest intersection right now with the opioid epidemic. Yep. And this, you know, trying to get women both antepartum and postpartum into care and their child adequately supported. So I think that's where we're seeing the biggest challenge now, because you have a new set of providers, the substance use providers, who are also so used to holding information super closely. So we have 40 CFR Part 2 bumping up against the privacy concerns that were discussed earlier in the child welfare system, and the combination of the two just seems to be very challenging.
Yeah. Kimberly Keels, can you unmute and talk about about your message, or can you not, or do you not have sound? No sound.
Got no sound.
Okay.
I mean, back on this, I mean, more broadly speaking, I mean, the confidentiality question in child welfare is I think it's a major Achilles heel. Adam will know this. I mean, as a journalist trying to cover the system, we've done a lot. The whole reason why we do the work we do is basically because the mainstream media narrative about the child welfare system is that it is broken because of this myopic focus on child death by mainstream media.
Right.
And a large part of that is because this prevailing ideology of confidentiality, which is in some cases true, some cases not true. Look, half of the states in the United States have presumptively open juvenile dependency courts where anyone, including a journalist, can walk in and watch the proceedings in real time. So why, do systems so often stop worthy requests from being granted? And I think that, that kind of external issue plays internally too, and in exchange with other systems. And I think it's, it's an endemic problem across systems that serve vulnerable people, but, there has to be something. And so I'm very happy that you've got Daniel Stein, Adam Pertman, Sandes, and the whole crew at the NIC trying to figure these out, because, this is a real killer.
So let me underscore what you just said. I think it's a bullseye. I remember my own experience as a journalist trying to get information, really basic, public, nothing was going to identify anybody, hurt anybody, and you couldn't get it. The information that you can get is when a kid dies, when a kid gets hurt. And so it skews people's perceptions of what's happening in that system, because all they hear is the bad news. And the consequences are very real. It becomes a vicious cycle of not wanting to release news because it's bad news and people perceive it badly. And the consequence is that people have this skewed, off-kilter understanding, if you will, because it's not really an understanding of both the system and the people in it.
Definitely.
All right.
Can we go to the next slide, Sunday?
Yeah, Daniel, keep going.
I'm done with my slides. I want people to chime in, and we're bumping up on the last 10 minutes anyway. So, here Mary McCarthy says the core of confidentiality in child welfare is actually risk aversion driven by attorneys and program staff buy-in. Yes. I was just talking about the amazing thing that the federal government is offering a entitlement stream of funding to pay for attorneys. I like that when that's defending parents who would wrongly be separated from their children, or children who need better support from their attorneys in the system. Yeah, but I think the attorneys working for, the of counsel or, in-house for these child welfare systems, really hurt them. What Adam's saying is true. It really does hurt them. And I will say, just to put a button on what Adam had tried to say earlier, which is just this spread of this system. 1 in 8 of all American children, that's 12%, will by the time they turn 18 be found will have a case of substantiated abuse or neglect. 1 in 8. 1 in 3 of all American children by age 18 will be investigated by a child welfare investigator by the time they turn 18. 1 in 2 black children will be investigated for child maltreatment by the time they turn 18. This is, when we think about, and we've had the opportunity to look not just year by year, but cumulative analysis of the impact of the system. And, Adam's showing it to us from the adoption side. But, this system, which is getting you know, an $8 billion allocation directly a year, something like that, tiny, is really touching a lot of people. And so I think, you know, there's so many different ways to come at it.
I'll punctuate that. Oh, sorry, go ahead.
Go ahead.
Punctuate that with one other, it's not a statistics, it's an overall finding. There are statistics to back it up. And that is that if we don't act, if we don't help these kids, if they wind up what they call emancipating, aging out of the system, the numbers are wildly disproportionate of those young people who wind up in jail, on the street, pregnant, unemployed. It's horrific. The numbers are just awful. And there you see the real cross-sector impact, because it affects every part of our culture when we don't intervene earlier.
I offer 3 stories just to talk about the issues that we covered. You know, there's a kin care story. Kin prop up Illinois foster care system with limited support. Year-end spending bill includes hundreds of millions for Family First Act, you know, and then New York's parent defender model lowers reliance on foster care steady fines. So that's, back to Stephanie's question, that's the story where we talk about the research showing that, you know, time and care is reduced by quality representation. So, you know, these are some ways to really make things better. Next slide is, I think, my last one. So, obviously, I want to hear from you. I think I already got an email from somebody, so that's great. But I'm the publisher, and you can see my ridiculously long email there. And then John Kelly is our editor-in-chief, who is much more, much more intelligent on all of these subjects and much more prolific than I am. So you can email either of us whenever. We have a question from Marina that I'll try to answer. If confidentiality is Achilles heel of child welfare, where do you see initiatives, innovation to improve that? I mean, I think that one area are the states that have been, like I've been saying, I was just recently in Ohio. I can walk into any juvenile dependency court in Ohio and sit there, and I can bring a camera in pretty much. In LA County, which was long revered as very open because we had this, you know, this nationally recognized judge, Mike Nash, who kept it open to the press. Now they're shutting us out. They're physically barring our entrance into court. And I think that, you know, having presumptively open juvenile dependency courts is a good place to start. You know, and so I think that, because I think if you have people able to see it, the question is if there's enough journalists left, enough people who care left to go and actually report on these proceedings. But you see, like, for example, there's a whole movement to kind of send volunteers into criminal proceedings to see how prosecutors are behaving. And I think we could do the same in child welfare courts.
Okay, thank you, Daniel. I don't know if Daniel Stein is with us verbally or not. Are you, Daniel? No, we don't hear you, Daniel. Okay, we only have a few minutes left. I think, Daniel, you trying to mute? Okay, so we would just give you does anybody have any more questions before I wrap it up? Okay, I don't see any. So I'll thank you all for coming and for participating in this webinar. I think it's real important, and I will say to add to Daniel Hempel's, please feel free to email me as well. My email address is on the first slide of my own presentation today. So we have a couple of, I don't know, Daniel was going to do this, so I don't know which decks we have, but our next webinar on March 6th is going to be with executives at Bright Hive, which has some really interesting, which is doing some really interesting work in addressing data collaboration challenges. I think that'll be, as far as Let's Get Technical goes, that'll be a presentation that's right on the money for everybody. And I do urge people, even if you came on today just because it was a child welfare topic, I think that a lot of you will be interested in the other work that we do as well. It really does touch your lives in ways that Daniel and I discussed today. And then the libraries, we jumped forward a bit. We will have sessions on the subsequent Fridays in between the two you're seeing here. The library one, we've attended a couple of webinars of these folks. They're really proficient, interesting. They talk about interoperability in a different way and reaching communities in a different way through their public libraries. It's a fascinating look inside something that's really working and redefining itself in communities literally across the country. I urge you all to join that one as well. And I think, and for those of you who haven't, I'll reinforce what Daniel said at the start. Please go to the URL that you see on your screen right now and join us. You don't have to participate all the time. You will find out what we're up to. You will be able to jump into some of the groups that we have formed, and you will participate in what we are trying to create, which is this community of networks around the country, which we think, we know now, because we're a couple years old, is being of genuine benefit to the participants in it. And with that, maybe a whole minute early, I think we can wrap it up. And so thank you, Daniel Hempel, very, very much for bringing this, what I certainly think is a very important topic, and I think that everybody on the call agrees. So thanks, everybody, for participating, and have a great weekend.
Thank you. Bye-bye.
Bye-bye.
Okay, got done with that.